Trevor Project is the world's largest suicide prevention and crisis intervention organization for LGBTQ plus youth. Its new study found they face higher rates of suicide because of how they are mistreated and stigmatized. LGBTQ plus youth also report higher rates of mental health challenges.
Dr. Ronita Nath is the Vice President of Research for the Trevor Project. She led the study and she joins us here this morning to share what they're hearing from the community. Thank you so much for the work you do and thank you for joining us.
Thank you for having me.
Dr. Nath, you surveyed over 16,000 LGBTQ plus youth ages 13 to 24 last year. Can you tell us some of your key findings?
Yes. So, firstly, our country is grappling with a youth mental health crisis, which is particularly pronounced for LGBTQ plus young people. And in our 7th U.S. national survey, the findings confirm what we have long known to be true, that LGBTQ plus youth face high suicide risks, not because of their identities, but because of how they are mistreated and stigmatized in the country. Access to mental health care remains a significant barrier for this high-risk group. 44% of those who wanted mental health care in the past year were not able to get it. And when we asked them about those barriers in accessing care, it wasn't like logistical barriers only regarding, transportation or affordability. A lot of those barriers were around fear and trust. But I think the most powerful thing our data show is that not that LGBTQ plus youth face elevated risk, it's that when adults, institutions, and communities become more affirming, that risk goes down.
Yeah. That makes sense, right? Because you're validating their experience. So you also found that rates of victimization because of anti-LGBTQ politics were higher. Talk about that a little bit. And I just want to say, I think a lot of us who are allies have been quieter the last couple of years. So I just want to go ahead and say, if you are an ally, we should be speaking up here.
Right, for sure. So, it is important to contextualize these findings within the social and political realities that LGBTQ plus young people face every day. Already 2026 is on track to be yet another record-breaking year for anti-LGBTQ plus legislation in the U.S. and for anti-trans legislation in particular. And so, we asked young people how these recent policies, laws, and debates affected them. And an astounding 90% of LGBTQ plus young people said recent LGBTQ plus policies, laws, and debates caused them stress or anxiety. 78% said it made them feel unsafe. Nearly a third said it made them or their family consider moving to a different state. And almost a quarter felt unsafe going to see a doctor or going to a hospital. So, we do urge all politicians and members of the media and anyone debating about LGBTQ plus young people to understand that their words carry weight, and respecting and supporting the mental health of young people in this country should not be up for debate.
Absolutely. And you just mentioned that your study also found that LGBTQ youth reported lower suicide rates when they had access to the supportive spaces in the community. So explain how we as a community can help encourage these safe environments.
Right, yes. So very powerful findings that show that LGBTQ plus youth reported living in very accepting communities attempted suicide at nearly a third of the rate of those living in very unaccepting communities. And so we asked young people, what does that mean to show support and acceptance? And they said, trust that I know who I am. Don't support politicians advancing LGBTQ plus legislation. Stand up for me. Respect my pronouns. Show support for how I express my gender. Look up things about LGBTQ plus identities on your own to better understand. Display pride flags. And so, it really shows us you do not have to be an expert in LGBTQ plus identities and topics to show young people that you support them. We can all do our parts. And, just the smallest actions can make a life-saving difference.
So I want to ask you before we have to let you go, the Trevor Project had a new section in the survey where you asked what resources would be most helpful to LGBTQ youth. And I want to get to this, what to say to someone who does not know what it means to be transgender or non-binary. Can you give me both responses?
Right. So, we asked young people to, we passed the microphone on to them to explain, some of this data. And so, what to say to someone who doesn't understand what it means to be transgender or non-binary. Young people had some great responses, but overall they're saying, being trans means a young person's internal sense of who they are, their gender, when it doesn't fully match with the sex they were assigned at birth. It's not about them pretending or confusion or belief on their part, but a real and deeply felt aspect of human identity. And they're saying, you do not have to fully relate to one another's experience for it to be real. You only need to accept that their experience of themselves is valid and worthy of respect.
Go ahead.
Just thank you for educating us. Everything you're sharing this morning, I think we do need to hear these facts and what we can do as a community to support the youth. So just wanted to say thank you.
Yeah, and I think when it comes to transgender youth, I think there's research that shows that as young as 4 years old, people start to feel that they may not be in their same gender, so that it is something that people feel for a very long period of time. It's not just something you wake up and decide to do. Yeah. All right. Thank you so much for being with us. We really appreciate the work you do.
Thank you.